Good afternoon. My name is Lisa Balsera with USF Health. Thank you so much for joining us today. I'm delighted to be with Dr. Jill Roberts. Dr. Roberts is Assistant Professor at the College of Public Health. Thank you so much for being here.
Thank you for having me.
So we're going to talk about the flu season. So what are you expecting and the CDC expecting for the flu season this year?
So CDC is expecting a pretty bad flu season. This is based on data from other countries. So countries in the Western Hemisphere will have flu a little bit earlier than we do. And we've seen some pretty bad numbers so far. So it looks like our season will be pretty bad. It was bad last year, about 50,000 deaths occurred.
Oh, wow. And so when should we get vaccinated? Is it ever too late to get vaccinated?
It's never too late. As early as possible is best when we start to get at the end of summers and we want to start thinking about getting those vaccines. But it's never too late. And in fact, people who've had the flu can actually still get vaccinated because the flu vaccine contains 4 different strains of flu. So if you've had one, you've only had one. You're still susceptible to the other 3.
Okay, that makes sense. And so what exactly happens in your body when you have the vaccine? And do you always get a cold or a flu right away?
So the flu shot is actually designed to create an immune response in your body. So it tells your body, here's some flu antigen, this is what this is going to look like. Start making antibodies, start getting cells ready so that when you see the real thing that you're ready. Now what it doesn't do is it can't give you the flu. Okay, so it's not a live vaccine. It's not going to cause the actual flu itself. Instead, what it does is it creates an immune response, which creates a reaction that makes you sometimes feel a little bit sick. So your immune system gets excited. Sometimes you can feel a little bit tired. Even some people can get a little bit of fever, although that's rare. It's usually gone within a day.
Okay, and how often, I mean, is this like obviously there's different strands, so you do it once a year and then, is that good?
Yeah, unfortunately the flu is a virus that mutates really quickly. And so every single year the flu that comes around looks a little bit different than it did the last year. If it looks a lot different, we have a really bad flu year. And so unfortunately the result of that is we have to get a vaccine every single year. Now it's good to stress that the last year's vaccine didn't go away. You still have those antibodies. So in the future, should the same kind of strain come around again, you're still protected.
Okay, excellent. And we were talking earlier about herd immunity. Could you explain that a little bit more?
So the more of us that get vaccinated, the less likely we are to get the flu, and therefore we can't spread it. So for example, if I have been vaccinated, I can't get the flu, I can't give you the flu. So you can't take the flu home to your family and your coworkers, and that's how herd immunity works. Some diseases you need a lot of people to be vaccinated to prevent them because they spread very easily. Example is measles. Flu does not spread very easily, so you only need about 50% of people to get vaccinated to see a true herd immunity effect.
Okay, makes sense. And what about, we didn't talk about age. Is there a certain age you should or shouldn't have the vaccine?
Any age can actually be vaccinated, but there are groups that are at higher risk. So individuals that are very young and individuals that are older, they can be at high risk. But interestingly, sometimes we have a strain that comes around that actually attacks that middle group. So swine flu that we all remember, it killed 20 and 30-year-olds. So everyone should be vaccinated.
Okay, and if you have some other condition, some other comorbidities, is it a bad idea to get it?
It's even more important.
Okay.
Yes, because what we see is that having influenza increases your risk of heart attacks. So especially if you have heart disease, you definitely don't want to get the flu.
Okay, and you're offering a free flu shot here at the College of Public Health?
That's correct. So next Friday at October 18th, we are having a flu shot vaccine here at the College of Public Health. The shots are free and we will have them until we run out.
Okay.
So please come out and get your shot.
All day long?
All day long.
Okay, excellent. Well, thank you so much for your time.
Thank you. I appreciate it.
Thank you.